From humble beginnings with a desire to serve the Dudley community, Bank of Dudley has grown to 5 locations, serving Lawrence, Twiggs, and surrounding counties. Serving our community since 1905, the Bank of Dudley is looking forward to its second century of community banking. Drop in today to any of our 5 locations: Jeffersonville, Dudley, East Dublin, Veterans Boulevard, and downtown Dublin. Bank of Dudley, member FDIC, and an equal housing lender. Welcome everybody. I am really excited about this show that we have today. I have with me, first of all, I got some really informative information for you today, and we're going to be airing this several times, so I want you to know, sit down and watch what we're going to be talking about, because I'm telling you, I've got Rose Oxley with me first of all, and tell me, Rose, a little bit about your business and let our viewers know what you do.
Fantastic. My name is Rose Oxley, and I'm the owner of Drug and Alcohol Testing of Georgia. We are a very blessed business here in Dublin. We've been in business 19 years, and it is just a blessing to be able to be here. Thank you so much. With our business, the thing that we do is we want people to understand the education part of our business. Yes, we do drug and alcohol testing, and yes, we do physicals. We do many classes, but what we'd like to get across is what we can do to help the community and how we educate students, how we educate parents, how we educate law enforcement, including police officers, deputies, probation officers, and judges. And then we turn around and we educate the employer, which is a lot of time a second parent education. So, you know, this is things that we're involved in the community, and are just so wonderful, you know, to be able to do this. My team and myself, we're so passionate about this.
Okay, tell me about, and just so you know, Rose and I have had, I don't know, we've talked a lot about this. Yeah. And when I first talked to her, I got excited right away, because we're all going to learn. I've already learned some, but I'm really going to learn a lot today. But when I first went in your business, a couple of the girls grabbed a hold to me and started showing me the displays, which was just a little small part of what you do. And look, we're never going to get to everything she does today. So, you know, but we're going to focus on education, and we're going to be educated. But tell me about the girls we have with us.
This is our education team. We as a team go out and we teach probably 25, 30 different classes, all type of classes. I'd like to introduce Hilda Taylor. She is our education coordinator. She's been with our company for 19 years. She is a 17-year paramedic with Johnson County Ambulance Service, as I am also a medic with Johnson County. And this is Leslie McNamara. She's been with our company a year and a half now, and she is a 5-year medic with Johnson County Ambulance Service. The thing that we have in common, that we can take to the public, that we can tell them, we know where you're coming from, we know the problems, is because everything that we deal with on a daily basis is drug and or alcohol related. And we're not just talking about street drugs. We're talking about the #1 drug of abuse today, which is opiates, narcotic pain pills, and their substitutes. So this is stuff that we deal with every day. We're a very close-knit team. We do everything together, all the way from defensive driving to the drug and alcohol awareness and reasonable suspicion, and many in between. But they are a wonderful asset to our company.
Yeah, absolutely. Leslie, what got you in this field here?
Well, like Rose was saying, I'm a medic with Johnson County EMS too, and I'm a previous addict myself. I've been clean for almost 6 years now, and so it's something that's near and dear to my heart as well, because I see the outcomes that we have, and not only my family face, but what I face as well when I was doing drugs. And so to educate, especially our younger people, you know, the high schools and our law enforcement that see this on a daily basis as well, it's something that needs to be done in order to stop the epidemic that we have.
What would you say to someone watching us right now? They're sitting in that chair at home. They may be smoking a joint. They may be doing drugs right now. The odds are somebody is. You know, with the tens of thousands of people watching us, you know, I'm pretty sure somebody's doing drugs right now as we talk about this. What would you say to that person? You've been clean 6 years.
Yes, sir.
It's changed your life.
It has. It's not worth it. It's really not worth it. I gave up a lot. I almost lost my husband, you know, because it wasn't worth it to me at the moment. I wouldn't have had my daughter, you know, so it's just not worth, you know, laying on the bathroom floor knowing that there's a chance that you're not going to wake up the next morning. It just really isn't worth it. And we'll look where I'm at now.
Now, isn't that a blessing? Isn't that a blessing? How much better does it get right there? That's what this is all about, that education.
Yeah, absolutely. And family, you know, and I hear from people all the time. I was talking to a guy who loves to smoke pot, and just full disclosure, Rose and I have talked. We grew up in an era where people smoked pot.
Oh, yeah.
So we're just as guilty in our previous past.
We've
so
been there.
Look, it don't matter. It don't matter. You can
It's
stop
not a guilt trip.
No, it's not. This is not a guilt trip.
No.
And we're not up here high and mighty, acting like we're something that we're not. But anybody, and I'll say, if you're willing, God can see you through it. I'm telling you. I tell people that all the time. But tell me something before I talk to Hilda. You know, people say, well, I'm not hurting anybody else.
You are. You are hurting somebody else.
She answered that quick, didn't she?
Because it's not just you that you're hurting. Yeah, you're putting these toxins into your body, but I watched my mom suffer. I watched my grandma worry, and she stayed up all hours of the night, you know, wondering if I'm coming home, when I'm coming home. And it's just, you don't think about them, but really and truly you're hurting them more than you're hurting yourself, because you don't care. You're high. You don't really give a rat's tail, but they do.
That's right.
So.
Yeah, that's pretty strong though. When you think of families,
That's right.
grandma, mama, daddy, brother, sister, you know, friends,
Kids.
your children. So
Right.
let me squeeze between y'all right here. I got to talk to Hilda over here. Let me get up close enough to talk to you. Hilda, tell me what got you in this field.
Actually, Rose got me into this field. She adopted me into the family 20 years ago.
Wow.
So I don't have the experience of drug use, but I've seen what it can cause. And that's the whole purpose of pushing this, because I've seen what it can cause.
And I know you've had many people come up to you doing, I'll say shows. I don't know if that's the right, is that the right word? When y'all go do, okay. Yeah, okay, good. Thank you for working with me on that. But and setting up displays. I know y'all go all over. I was talking to Rose a few weeks ago. She was in Savannah, I believe, with Judge Harper and the probate judges. They had a convention down in Savannah, right?
St. Simon's.
St. Simon's. Right. But, you know, so y'all talk to a lot of people. Tell me about a few stories about through the years, people coming up to you and wanting help, needing help, asking for help.
There's been a lot of drug use. Most of the time, in the experience that I've had on the ambulance side of it, they're not looking for help. In the office side of it, we do have the few that comes in there and says, I need help. And we go to the steps that needs to be taken as far as getting them into a rehab unit, directing them in the right path.
Since we're talking about total transparency, I want everyone to know that I'm such a blessed person. I'm 41 years clean. I am a recovering addict. So when people come up to me and say, you just don't know what it's like, I've been there. I've lived in a car. I've begged for food. I've been there, you know, but with the help of the good Lord above, things can change. You can change, and we can help you in so many different ways. We really can.
Amen. Leslie, I appreciate you talking to us. That was emotional And we may cry a little bit on this show today before it's over, but that was really for you to share that story with us. And like I said, somebody's watching us.
If I can help one person.
Amen. And that's why we want to do this show.
Yes,
we
sir.
want to help many people, but if we only help one, we've accomplished what we're here today for. But we want to give you information, parents, grandparents. We're going to show you some things today you may not know. You've seen in your home or in your kids' rooms or whatever. But we're going to show you some of that stuff today you need to know. So we're going to take a break. If you need to get something to drink, go to the bathroom, whatever, hurry up. Jump right now. We're giving you time. We're going to take a break. We'll be back right after this.
Hey, how you doing? Eric Kate City.
I'm good. Brad Grimes. I think I'm smelling some gas in my yard out here.
All right, and what area are you smelling at?
Over here in this area, the meter's on that side over there.
Okay, what we're gonna do is we're gonna check the meter and make sure there's not a leak there.
Okay.
And then we'll locate the line out and put down a couple holes just to check on the ground to make sure you don't have a leak. We'll check each corner of your house. If you could, just stay on the porch.
Okay.
If you think you have a gas leak, we're on call 24 hours a day, 7 days a week.
Call us at 478-277-5048.
Welcome back, everybody. Let's get started, Rose. Tell me what we got on this first display.
On our first display here, what we want to do is we want to help educate the public. Kids, if you have a project that you need to do and you want to get your point across about the deadly part of drugs, the facts about drugs, please come by our office. We have booklets. It's a little box of different booklets of all the different type of drugs. Wonderful information. I bet you make an A. Yeah, because it's great. A lot of information, but parents also. You know, one of the things that we want to make sure is that the parents themselves, you know, be able to get this information. Parents, come on by. If you have questions, ask our staff. They're awesome, they're very knowledgeable, and they can also pick up a box that has all the different drugs in it. Read up on it. A lot of people say, well, you know, I use it when I go to the bathroom to take a little time up, and that's great. Yeah. It doesn't matter as long as we get that information out. Okay. So we want to make sure that everyone knows we're at 1825 Highland Avenue. We're at the right-hand end of Home Depot, up next to Perfect 10. And we're open Monday, Tuesday, Thursday, Friday, 8 to 5. Now, we do go to lunch 11 to 12:30. And I know. But my staff works so hard. They are awesome. We're a great team. Amen. And but on Wednesdays, we're only open 8 to 12. We're not open on Saturday and Sunday, but there's a lot of options to come out and get information that you need.
Okay. And they're very helpful. I'm telling you, the first time I walked in, I was shocked at the attention that I got and the help and giving me information before I ever met Rose. Okay, I got to know this next display here.
Right.
I'm lost, so you got to help me here.
Oh, no, this is great. And this is really for parents and employers. This is a stash display. Everything here holds drugs. Now, it was originally made by the Absolute makers for being able to hide jewelry and money, like if you go on vacation. But now it's used to hide in drugs. But one of the things I'd like to show you is that one of the big things is going to be, if everybody remembers Michael Vick back a few years ago in the Miami airport, oh my goodness, he has suspected marijuana in his water bottle. Well, we know that, you know, if you put marijuana in water, you can't smoke it. Everything's gone. But this is the type of water bottle. Note, he did not have marijuana in his water bottle. But this is the type of bottle that he used. As you see, there's water in the bottom. Water can be placed in the top, and you can actually drink the water out of here. But what we want parents to see, and it comes in juices and Red Bulls, is the change of where you have a stash area. This area right here is all open, and things can be hid in it. And it just locks down, and you can drink water out of it. All of the containers here are that type of stash. Now, in your kid's room, one of the things people go, oh, he has a condom. Condoms are one of the largest stash items, and parents have a tendency to overlook it because they go, whew, at least he's using a condom for birth control, things like that. But this, as you see on the inside, has drugs stashed in it. So make sure you know what you're looking at and make sure that there's not drugs stashed in it. Different types. This is a big thing with the school kids, and it's a marker, and it does write and highlight with the marker. But if you pop this end off, you have a marijuana smoking pipe, plus area to hold your marijuana in here. So again, this being stash items, these are things, and as you can see, you can buy them over the counter, $14.95.
Where do you buy these at?
In any convenience stores, truck stops, vape shops, smoke shops, anything like that, these can be bought.
Amazon sells them a lot.
Yeah, online, big time.
Okay, the sunscreen.
Sunscreen.
I'm
Yeah.
curious.
And summer's coming. You know, everybody's going to be out in the tanning beds and everything. And what this actually is this is actually a stash container for alcohol. It's empty. There's nothing in it. It's clean. They fill it up with alcohol and they can drink.
Oh my goodness.
Right. So many different things that can be used. And this is one of the big things here. Look how nasty that looks. If that is sitting in your refrigerator and you're going on vacation, if someone breaks into your home, they're not going to open this. That looks nasty. But if they were to open it, as you see, yeah, everything is on the outside. The inside's empty. They hide their money.
So they're camouflaging.
That's exactly
what
it.
you're saying here.
That's it.
Okay. Wow.
Everything. And the table's full of things like this.
Yeah, we got bleach and OxyClean, and we got iced tea over here.
How about the credit card? How many times have you got a credit card or a debit card? Same exact thing. You can open the bottom of it and put your pills in it.
My goodness.
Yeah. So sometimes it's not a big deal to see a credit card or a debit card in somebody's wallet.
That's right.
But this is the way of today's world.
And this is
hiding.
why it's the light's coming on right now for me. But this is why you train law enforcement.
That's correct.
Or these kind of things that people think they've
Probation
outsmarted.
officers, law enforcement.
because
right.
they need to be doing it. Okay, let's move to the marijuana right here.
It used to be marijuana was a big deal. Back in mine, in your day,
That's right.
you know, everybody, it was still illegal. But now the consensus is it's just marijuana. But they have to understand it's still illegal. For kids to have that in their home, if the home is raided, parents go down for that stuff too, especially kids that are underage. But marijuana itself, you know, we can talk about it being illegal, but what we want you to know is ways that marijuana can get in your system without you realizing it. So if you've never looked at the ingredients of what is on the label, you need to start. Because small things like this is for tanning bed. It's tanning bed solution. And what it is if you look real close, you see a marijuana leaf. It has hemp in it. There is a good possibility you can show positive on a marijuana test for 70% or higher. The secret with these is there's nothing on there that shows how much hemp is in there.
So you're telling me if you go to the tanning bed, a lot of people do, which that's another show I would not recommend. That's another thing we learned at a young age, but stay out of the tanning beds. But people that go in the tanning bed and use this, when they test them at work, they could test positive and lose their job.
Yes, sir. Yes, sir. Just like the CBD oil out there, they'll say, oh, you can't be positive. You can take a few tokes, no problem. It relaxes you. And it does. But people like that relaxation. They become accustomed to it and smoke more and more and more. So don't be surprised if you don't show positive for marijuana.
Wow. Okay, let's talk about some of these other things. Okay, what about right here?
This is a hookah. The hookahs are used to smoke marijuana, smoke any kind of drugs. The bottom part of the hookah itself, this one being glass, the bottom part usually has water in it. What most folks do is they put grain alcohol in it. So as you're smoking through the stem itself, not only are you getting the marijuana, but you're also getting the alcohol effects.
Wow.
So, but it's all about the smoke there.
Okay. What about right here?
Okay. These at-home drug tests, please be very careful. These are not FDA approved. You never want to accuse a family member or anyone on being positive for drugs with an over-the-counter drug test. They have a lot of false positives. Anytime that there's a positive, it needs to be sent to a federally certified lab so that way you're not accusing someone. And the bad part about this is a marijuana. If they eat, let's say, a chocolate cake with marijuana cooked in it, they're going to get high. If they get high from the suntan lotion, they're still going to get high. But through a lab, there is no way of telling if they smoked it, ate it, or applied it to their body. So
I cannot get away from this information here. I hope y'all are listening to this, because this is crazy to me. I mean, you're telling me that they can get high off of this?
well, if it absorbs into your system with the high enough potency, yes, sir, you're going to get high. And that's why it's of abuse, a drug of abuse, because you can only get so high. And when you can't get any higher, they start adding drugs to it. They start adding chemicals to it to make a bigger and better high.
Going back to when we were growing up, it was just pot.
Right.
What is this? Talk about this.
Well, everything today is sensationalizing the drugs, making the street folks aware that, oh, look how pretty these buds are. And we even have a High Times magazine. You know, we have all of this, and it's to make it appealing to the public. But what they don't tell you is the actual facts. They don't tell you the chemicals that are in there that go into your body. And people, you know, oh, that's just marijuana. It's not a big deal. The chemicals that are used in there that go into your body can add up and cause mental illness. You know, it causes anxiety. It causes depression. It causes people 1 minute to be fantastic and laughing and joking, and the next minute crying. It all depends on the chemicals, and we'll get into the chemicals a little bit more.
Okay. So basically, in a nutshell, you're telling me the Honolulu Rose or the Hydro Skunk or the Dutch Treat or whatever, you're talking about the chemicals they put in it to grow this marijuana? Is that what you're talking about?
Right. These are different types of marijuana
Right.
that's grown. And depending on what it's grown in, what it's dusted with, things like that, that adds chemicals to it, which that transfers to your body during the smoke.
Okay. Okay, let's take a commercial break, and we'll be back right after this.
Stop in today at your Wrightsville, Silverton, or Adrian Jet food stores for breakfast made fresh daily. The best breakfast biscuits and breakfast platters around. Join us for lunch with fresh chicken, pork chops, fried fish, fresh vegetables, as well as a daily manager special from chicken pot pies, meatloaf, and beef tips and rice. Hungry yet? Hurry into your Jet food store today, and don't forget to call ahead, and we'll have your favorite Hunt's Brothers pizza made to order. Come to your hometown Jet Deli today.
Welcome back. I have with me Rose Oxley, and we're talking about drugs, the effects of drugs, and man, so many things to do that, you know, I've learned a lot, and I'm sure you have. If you're just joining us, we'll be showing this several times, so we will air this again, so you'll be able to watch it. But before we move on to the cocaine display, you know, marijuana, you know, people say, well, it's just marijuana. But
Right.
but am I wrong to think that you know, a lot of people start with that and then they go to cocaine or meth or whatever.
Yeah, you're not wrong at all. Not wrong at all. When they go into further drugs like cocaine or methamphetamines, normally it's someone who has used marijuana and they've gotten as high as they can with it. They've dusted it, they've basted it, they've done all of this. But marijuana is considered a gateway drug into bigger stronger types of drugs.
And those chemicals she mentioned, like I said, if you're just joining us, we were talking about marijuana and all the chemicals that are put in it. I was talking to a police officer recently and told him, we're talking about marijuana, and I said, well, look, I'm just going to tell you, I'm against these states that are voting this in. I'm against any of that. I just don't think we ought to be legalizing any type of drug. And that's just my personal belief. I don't think we should. But this police officer did tell me, he said, James, I had rather them legalize it so we know what's in it. Because this marijuana we're getting off the street, he said just what you said a while ago. He said, you will be shocked at what they put in it to get people higher.
That's right.
Embalming fluid was one of the things he told me.
Yes.
Embalming fluid?
Right.
Wow. I would hate to think that that's going in my body.
Right.
And it very well.
We're all going to get that possibly at one time or another.
That's right.
But let's not do it while we're alive.
No.
Right.
No, absolutely not. Okay, let's go to the display on cocaine here.
All right. Well, cocaine is we're not going to tell you about it being a powder and that it's illegal and things like that. But with cocaine itself, there's a lot of different things that we can go on. If you're not 100% comfortable with the person that you're having sexual intercourse with, please be very careful, because any spot on the body that is dark and moist is very fast absorption. This has been used many, many, many times in date rapes, things like that, and we'll talk about the #1 date rape drug in just a minute. But cocaine, and you have to stop and think of those places. Your eye, the lower part of your eye, your nose, your mouth, the vagina, things like that. These chemicals and cocaine being placed in there. But let me tell you what causes people to desire cocaine. The very first time that you use cocaine, there is a high that people explain that is next to God.
That's
next
scary.
to God, that is.
That's scary.
And that first time is the only time you will ever have that high. So even if it's, and the high lasts 8 to 15 minutes, that's it.
So you're after that, you're chasing that high.
That's it.
What
You're
saying.
chasing it because that was the ultimate high. You do it again. The same cocaine, and you were almost there, but not quite. So you do it again. Well, if that's not good enough, you add a little something to it to try to get to that high. And it's a drug that all you do is chase.
Okay, let's back up here. Go back and re-explain. You were talking about places on the body. You talking about sores or
No, sir.
Well, I didn't grasp
No,
that.
sir. We're talking about any place. Stop and think. For an older person that's having chest pain, they usually take a nitroglycerin, little bitty tiny pill that they put under their tongue. It's dark, it's moist.
That's it.
There you go.
I told it everywhere.
There you go. So when you have chest pain, you take one out and you put it under your
That's right.
tongue. It absorbs into the body very quickly
very quick.
and does what it's supposed to
That's
do.
right.
All right, so drugs are the same way. It doesn't matter what you're placing there. You know, if you put that nitro here, it would take a little bit longer. It's called the lower conjunctiva, but if you put it in the bottom of your eye, it takes a little bit longer to dissolve. May cause a problem, of course, hurt, but when you're doing drugs, that doesn't matter.
Wow.
So you're looking at a dark, wet, or moist area up the nose. Think about people who snort cocaine. The lungs, they smoke crack, smoke coke-dusted marijuana, stuff like that. Here it goes into the lungs and out into the body. They rub it on their gums, under their tongue, their cheeks back here. We could use all kind of medical technology names, but technical names, but no big deal.
Right.
And then the vagina, you got to stop and think.
My goodness.
Yeah. You know, so it's a very dark, moist area. So these are places that this stuff absorbs very quickly. And especially if we're using something like this, which is a balloon that has cocaine in it, and law enforcement comes up and you take it and you swallow it, the acids in your stomach will start eating away at this balloon. If you're using thin plastic and that there's a hole in that bag, people can overdose and die. This is things that you see like in your jails, things like that, because they're trying to get rid of the evidence, eating and swallowing. Well, there's you a big, dark, moist area that they have dropped it in, and it eats through, and that's what happens.
Okay, let's take another commercial break before we start on this next display. It's the toughest one for me as I watched the girls, Leslie and Hilda and Rose, setting up the display. I'm having trouble even looking at it. So we're going to show you what this drug does to you. Stay with us. We'll be back right after this.
Oh, hey, you got one of those insurance apps too? You know how this thing works?
No, sorry. Not an app, it's my agent.
In this moment,
No, I'm fine, thanks.
it's good to know you have a trusted, independent auto owner's insurance agent who's there when you need them.
Great.
Man, I gotta get one of those.
Orr Insurance in Dublin is your local independent auto owner's insurance agency.
Welcome back, everybody. We're looking at, I call meth. What is the proper name, Rose?
Methamphetamines.
Okay. Methamphetamines, okay?
Yes, sir.
Okay, let's start with what you have showed me prior is this
Meth lab.
Meth lab.
That's exactly
See,
what
I
it
don't
is.
picture this. When I hear meth labs, I don't think, okay, talk about what we're looking at.
Right in the middle of the table there, the two purple jugs, that is considered a meth lab. It's called a Beavis and Butthead or a Jethro and Bubba meth lab. And as you see to the right of the meth lab, these are the ingredients that is needed to make the meth. Denatured alcohol and any type of souped up pills, anything that just keeps you going that you can buy at any convenience store. On the left-hand side, as you see Drano or Red Devil Lye, any of your crystallized drain cleaners, and matchstick heads. That's what it takes. If you look right in the middle, there, the glass, you see once this meth has been cooked in this lab, this is the results. The bottom part, the white part, is called paste. Paste is waste. This stuff is deadly. This is why law enforcement has to call out hazmat teams. It will literally eat through metal.
Yeah.
So, and the clear on the top is your methamphetamines.
But if you're renting a house, and they go in and bust, and they do use the hazmat suits, that tells you how dangerous it is, the chemicals.
Yes, sir.
But people have to go in, rip out sheetrock and
They do.
and all kind of things in that house. You know, this. Tell me about this hornet spray. Now, I use a lot of that during. I've already used some already this spring because they're already building nests. But
Right.
But I wear safety glasses and I wear a mask.
Right.
When I spray that, because I have had it come back, the wind grab it and come back on me. So
Makes your tongue numb, don't it? When it
yeah,
blows
it's
back.
that's not something that
Right.
I want to inhale either.
Right. And the reason that is because of the nerve agents that's in that poison. Same way with ant and roach spray. It has a nerve agent. You know, we've heard people from the past, you know, our generation that says, "Honey, she's as crazy as a roach sprayed with bug poison," because it's a nerve agent. You know, when that bug gets sprayed, it flips over on its back and it kicks its little legs.
Yeah.
That's the nerves that are being affected by that poison. What they're doing today is taking the methamphetamines. You see the screen right there in the front. It's attached to a battery with a positive and a negative. They take the methamphetamines, put it on a tray, and hold the plastic edge of that screen. Take the bug spray and spray it, which electrifies it. Isn't this awful? Electrifies it, turns it into a white powder, and all they do is bump it. so that white powder goes down in. So they're adding more chemicals, thousands of chemicals, to the chemicals that they've already added.
I told y'all this was hard.
Right.
As you're watching with me, folks, as you watch this display with me, I know it's making you sick also to think that people are inhaling or smoking or shooting up, whatever they're doing. So let's move up to these before and after pictures. Tell me about that.
Aren't they something? These are pictures of before and after methamphetamine use. And as you see, probably one of the most drastic ones are right there in the middle. 32-year-old female, and look at the change at the age of 34. 4 years later, finally 40. She looks like she's in her 60s. And then you just keep going downhill. The addiction is so strong. There's nothing else that matters out there to an addict. You know, it doesn't matter if you eat. It doesn't matter if you drink. Because when you start coming down, your number one concern is your next high. You know, I mean, this is used, methamphetamines is used on kids in human trafficking. They become addicted to it to make money. One of the big things about methamphetamines is that meth mouth. It causes your teeth to rot. Now, not everybody that has rotted teeth has meth mouth.
Right.
You know, let's not stereotype anyone. But
that's what it does.
That's exactly what it does. It causes that rotting. And one of the things that we see a lot of is if you stop and remember just a few years ago, how about all the kids that were walking around with the pacifier on their finger, covering their mouth, and they were chewing on those pacifiers? The chemicals in these drugs, normal side effect of the body, causes people to grind their teeth. What they have found is in high schools or elementary schools where this is being used, teachers have a tendency to pick up on students who have problems with their teeth that are just getting worse and worse. So what they do is they slide that pacifier on their finger and they sit there and they chew on the pacifier so they're not gritting their teeth. A lot of people even use the Invisalign retainers to keep their teeth from clenching together and grinding.
Wow.
Methamphetamines used to be the poor man's cocaine. And these things that are made in these home labs, which are also called clandestine labs, you never know what you're getting. If they run out of something, it's whatever they can steal, whatever they can buy. And, you know, now in the stores, you can only buy so many Sudafed because that's one of the biggest things they use.
Yeah.
That way you see a red meth or a pink meth because the Sudafed, as you see over there, is red.
And you have to show you an ID.
That's right.
That shocked me the first time I bought something like that and wanted to see my ID, and the pharmacist explained that. So, wow, this is that's just incredible what we're looking at there. Okay, one of the biggest problems we have in this country is opiates.
It is.
Let's talk about that.
Oh my gosh, opiates are so easy to get a hold of. Because if you twist your ankle, the doctor has the tendency in the past to give you a 30-day supply of narcotic pain pills. And anything that you do for 30 days straight is a habit. So now you've picked up this habit. And so many people would think that when they ran out of pills that they were coming down with the flu or a virus because they were having abdominal cramps, shaking, diarrhea, nausea, vomiting, and they thought they were coming down with the flu, but they're not. They're going through opiate withdrawals. And how do you stop that? You get more opiates. Well, the president, Congress, everybody has said, oh my God, look what's going on. They've put tight restrictions against the physicians. They cracked down on what was called pill mills, to where you could go in, slide your money under the counter, get a prescription, go get it filled with pills, or you could buy the pills right there. Well, a lot of that's been shut down, and that's great. But you know what it's caused? It's caused the heroin epidemic now, because your ultimate opiate is your heroin. So what we used to think in the past of, oh my God, that's a heroin addict, they stick it in their vein, you know, that's all back now because the doctors can't prescribe the opiates like they used to. When if you're on pain management, when you go in, you have to have a drug test. Parents don't think about their friends having friends over and them going to the medicine cabinet, going to the women's underwear drawer, because that's where we keep everything. We hide everything in the underwear drawer. And they just take a few pills. You know, grandma, she don't pay attention to her medicine. Let's get a few of them. Nursing homes, the patches, the fentanyl patches, the Duragesic patches. They go in and take them off patients. Take them off their skin, barely slice the back, fold it in half, and put it where? Dark and moist under their tongue.
Oh my goodness.
We have so many drug overdoses because of that. You know, a story of that, of course, it was on the news, but a son or a grandson, just so loving of their parent, was going to the nursing home every other day, you know, and seeing them, what they were doing was taking the patch off of grandma. She has severe arthritis everywhere. She's eat up with cancer, in so much pain, and they're taking her pain patch to get high.
That's what Leslie was talking about earlier.
Right.
You know, these things we're doing. So, folks, and I'm telling you, you got to put those medicines up.
Lock them up.
Even, of course, the medicine I'm on, blood pressure medicine, things like that, because we have grandkids. We keep it in a safe. And they're young, but my whole thing is, what if one of them, you know, pulled it out of the drawer and took a blood pressure pill, or, you know, and we're not talking about opiates or nothing, but still, whatever medicine you have, lock it up.
That's
I
it.
mean, that's the best thing to do.
That is it. Because an addict will mix and match meds. If they only have one pain pill and they want to get the most out of it, they'll take 2 or 3 blood pressure pills to lower their blood pressure, so they're already a little woozy, and then take the pain pill to get that extra high. I mean, it's a different world, James. It's nothing like what you and I came up in. And, you know, out there on the streets, you see, you learn things every day. When just about the time that you think, I cannot believe this, something new comes along. And it's so important for parents and law enforcement and judges and everyone out there to realize what's new, what's next, how it's being done, you know, and everything based on information, education. That's how we can help.
Wow. I know I've learned a lot. Don't go anywhere. Stay with us. We've got a little bit more information for you. We'll be back right after this.
Portions of this program are brought to you by Fairview Park Hospital, a leader in healthcare for Dublin, Lawrence, and surrounding communities, providing inpatient and outpatient surgery options and rehabilitation therapy services.
Welcome back, everybody. I was telling Rose and Leslie and Hilda off camera, I've been just totally speechless at times. And I know it's hard for you to believe because I'm very seldom speechless when I'm doing a show, but just some of the information, it's incredible, you know. And nothing really shocks me anymore when I see things on the news, but some of this has actually been shocking to me, you know, some of the information.
We hear that
here.
a lot.
We've got just a little bit more. Just stay with us, folks. And I told you we're going to run this several times. The information is incredible. But next we're going to talk about, as I look at barbiturates and benzo. Is that right?
Benzodiazepines.
Okay.
The benzodiazepines are nerve pills. That's your Xanax, your Transine, your Ativan, things like that. And it helps with nerves. The thing of it is it's a drug of abuse because it calms you down so much. They snort it. They crush it and snort it. They can smoke it. They dust their marijuana with it. They've even mainlined it. But then taking it with handfuls. You know, nerve pills themselves mixed with alcohol is a lethal combination. They're both depressants. It slows down the heart rate and it slows down the respirations. We work many, many deaths because of the mixture of the two, both of them being depressants.
What is the Visine? What is that?
Visine is the #1 date rape drug today. Because what happens is if you're sitting in a bar and you get a little buzzed, you don't pay attention to your drink. Somebody will take and squeeze a bottle of Visine into your drink, you drink it. Now let's stop and look at how Visine works. It's to what? Get the red out. There is a medication in there called tetrahydrozoline that takes the blood vessels in your eyes and kind of shrinks them down so that red is gone. If that medication hits your stomach in that quantity, what does it do throughout the body? It causes the vessels to squeeze down. And when that happens, you can become very disoriented to the point of being unconscious and unresponsive. So depending on the amount they use, they can literally kill someone with it. You know, in the high schools and the colleges right now, they think it's funny because if they put just the right amount in there, it gives somebody severe diarrhea. You know, so, oh yeah, that's funny. He was in class, he couldn't make it to the bathroom.
Oh, my goodness.
But what they don't realize is a drop too much can cause death. And that's the #1 date rape drug out there right now.
Wow. What about these CDs? What is that?
It's a stash container. You open it up. It's on the. It's up there with the rest of your CDs and stuff, but you can hide your drugs in it. A lot of them come with the little stink bag, and you can put the drugs in what's called a stink bag and put it in there. So if a drug dog is brought into to your vehicle or to a call, to your car or to the house, a lot of times they won't hit on it because of the stink bag that's there.
Okay. Last but not least, something that's killing people every day.
Every day.
Throughout this country, alcohol.
And we can talk about, it's illegal to drink and drive. We all know this. This is nothing new. But the things that we want to get across to you is, yes, it is driving under the influence of alcohol. But if you're on any of these medications or even a narcotic pain pill, it's DUI less safe in the state of Georgia. Just because your doctor has giving you a prescription for a narcotic pain pill, you still cannot drive it. You've got to read the inserts. So when we come to alcohol, we know we can't drink and drive, but let's talk about what these high school kids are doing. Alcohol is one of those drugs where you want to be wary around it around other people, because if we're in the proximity that you and I are, if I was drinking, you could smell it. Oh, yeah. Alcohol, you can smell. Well, parents and teachers and law also get the same, they've been drinking. So what these kids have started doing is, so that they can't smell the alcohol initially, is women will take a tampon and soak it in the alcohol, slide the tampon in vaginally, and it absorbs the alcohol very quick. They become very drunk very quick, and that is, they can suffer from acute alcohol poisoning, which can also lead to death. Now, we can talk about the women doing this, but let's talk about what the guys are doing too, because it's not just women. And this is a funnel. And what they're doing is like laying down on the floor, in the shower, in the tub, feet over their head, the funnel inserted rectally, and the alcohol poured into their rectum, which causes very fast being drunk, being altered. They got their high. Again, it'll kill them. But this is very big in high schools and in colleges. Yes, after a while, yes, the alcohol does go through the body, and yes, you can smell it. But for that initial high, one of the big things that, if you've noticed, the school don't request anymore is the alcohol sanitizing gel for these kids' hand. Look at this one. This one is pink berry. And if you smell it, smells good, doesn't it? Smells just like candy. So, you know, even though parents are trying to be very, very clean, very all together with their children, these kids put this on their hand and they smell it and it smells like candy. So they're licking it while it's wet. That's another reason that things have changed in Walmart. Look at all your kids' medicines. No alcohol. Children were dying because of alcohol poisoning in medicines, over the counter. One of the big things here is please read those labels of what you're eating, drinking, and applying to your body. Because this Vicks Formula 44D has a high level of alcohol in it. If you take this and you go to work and we come in and alcohol test you, I can't tell if you've drank a mixed drink at lunch or if you're truly taking this. It doesn't matter. Yeah, you're still under the influence and you can get yourself or your coworkers hurt. So those are the things that we wanted you to know about alcohol, because it's not going to do any good for me to sit there and go, you know not to drink and drive. Everybody knows that. That's right. So, but let's talk about the things they may not know that can help them.
Okay, we're going to take a break and we'll come back and wrap things up. Stay with us.
So what makes OFTC a top choice for college? Here's why. You get hands-on training, and OFTC instructors have years of industry experience. You see, when you have access to that kind of knowledge, it makes a difference. And with financial aid, grants, and scholarships, OFTC is affordable. You can step into your new career debt-free. Think differently about college and make Coney Fall Line Technical College your top choice. Registration begins May 1st and classes start May 16th. OFTC is an equal opportunity institution.
Welcome back, everybody. We're going to wrap things up. If you're just joining us, we've just had a show with phenomenal information. We're going to run this several times, so you can call us here at the station, check your guide at home. But anyway, just phenomenal information. Those of you who've been with us the whole show, I'm sure you're sitting there nodding your head and in awe like I am. But don't forget the information. I picked up one, the truth about alcohol. We talked about it at the beginning of the show. If you're doing a project at school, parents need information, whatever, grandparents, really good information. This is just one of them. We got it on everything, crystal meth and opiates and just about everything that you'd want to know. Rose, and we ended on the alcohol. And I can't get over the funnel.
Yes, sir.
The absurd things that people do this day and time.
That's it.
I hate to say it on the air, but it's plumb crazy.
I understand.
To do that. I mean, it is. It really is. But we've covered a lot. And, of course, we couldn't cover everything, obviously. But we went through and did a lot of information. What would you like to say before we go?
I would just love to thank you for letting us be here. Our team goes to great lengths to make sure that folks get educated in any and every aspect that we can. I'd like to invite everybody over by our office at 1825 Highland Avenue. If you want any of this information, whether it be for classes, for your own personal information, we do health fairs. We'd love to set up at a health fair that you're having to be able to get this information out to people. Ghost outs. We have 3 ghost outs this month that are fantastic, and those are done at the high school right before prom. A lot of times maybe right before homecoming also. That gives the kids a wonderful acknowledgement of the facts that are out there. We do different churches, we do schools, anything that we can get the information out to parents, and many, many, many employers have a drug and alcohol awareness class for their employees on a twofold thing. Number one, this is the rules for you to work here. You know, these are the rules you have to go by. And number two, here's the facts, not the street junk that you've heard, and and how wonderful drugs are.
That's right.
You know, because so many people with mental illness a lot of it is caused by the use of these drugs.
It goes hand in hand.
It does. It does. The homelessness, the mental illness, the just the fact that they're pulled from their family. And if we could just save one person per show that you're showing this, we'll come back next year and do this again.
Right. I mean,
so
and I get excited about thinking about that.
Right.
The information is right there on the screen. If you're facing Home Depot, you just look over to the right on the end there, and you'll see where they're at. But the information, the phone number, address, and all is right there on the screen. You shared with us earlier, you've been clean for 6 years.
Yes, sir.
And as you was watching us, and I know you do this all the time, but as you was watching us go through that, I'm sure you saw I was shocked.
Yes, sir.
How often does that happen when y'all are talking to people?
All the time, especially when we're in, like Rose said, we do a lot of high schools and the ghost outs and stuff. And we'll have kids that come up to us during break and they're going, "That's not true. Is that really true?" And their eyes are the size of softballs. And to see the difference, I didn't know it when I was growing up. I didn't have the opportunity that Rose is giving these kids and giving these parents to understand. I didn't know the truths. I knew the street myths, which is what all of these kids now know.
That's right.
But if we can get them the truth behind it, we can save one kid from following the path that I followed, which was my own dumbness.
Yeah, that's right.
But it's the education that's coming out, and I love seeing them shocked because it stops them and it says, "Hey, I don't want to do that. I don't want to be that kind of person."
Yeah. Hilda, you've been doing it 20 years. You've seen a lot of shock. Shocking is a word. We're going to go with that anyway. But I know you've seen a lot in 20 years.
Yes, sir, I have. And one thing that I would like to express, that if there is anybody that's having problems and they want to seek help, they can call us 24/7. It doesn't matter day or night, what time. We will be more than happy to help them.
Okay. Yep, absolutely. Good point. We hadn't talked about that.
That's right.
See, that's why you got them here.
That's why we're a team.
I mean, come on.
We have an awesome team.
Yeah,
we do.
There's no doubt. And they're not all here, so.
Oh, yeah, the office is still running. We've got 4 more. This is our education team,
right.
But everyone at the office is just as willing and everything. And I would greatly appreciate you to put my 24/7 cell number, because I do at 2 or 3 o'clock in the morning, I do get parents that call and say, "Miss Rose, my son came in, he's not acting right, or my daughter is just flipping out. Will you come drug test?"
What's that number?
478-697-4068.
Okay.
24/7.
It's right there on the screen. If as we're wrapping up, just grab a pencil. We're going to leave it right up there for you. But Hilda, Leslie, thank y'all.
Thank you
so much for coming. A lot of work. As I watched them set up this display, I told them, I said, "You're winning the award for the best display." We have a lot of people bring things in, but as y'all see, this took a lot of work to bring in. And this is just a little portion of the things they have and when they go out. So
yeah, our regular display, our large display, is 14 tables, and it covers all the rave drugs and everything else. So, we'll be glad to come out and set up and let people realize what's out there.
Okay.
Thank you so much for having us.
Churches, schools, civic clubs, whatever.
Yes, sir.
The number's right there. Ladies, thank you. Rose, thank you. We met a few months ago, I think, but and we've talked quite a bit over the last couple of months. But I really appreciate you coming and bringing the girls and educating us, because I've got quite an education, and I'm sure you're sitting there thinking, when's that show coming on again? I want to watch that again because I missed something. But ladies, thank you. Rose, thank you.
Thank you.
And thank y'all so much for joining us today.
Thank you.